Hello, and welcome to the Early Childhood Health Consultation January webinar titled Winter and Health, the Facts. My name is Maria Morgan, and I'm the project manager with ECHC. Our team is so excited for you to be joining the webinar today. Our program is in partnership with Wisconsin Department of Children and Families, housed at University of Wisconsin-Madison School of Human Ecology, and funded by the Preschool Development Grant. Our program's mission is centrally focused on supporting Wisconsin early childhood care and education providers, and centrally focused on promoting the health and well-being within children of their care. Our program's vision is around a sustainable statewide model working through health consultation, and again, centrally focused on promoting the health and well-being of children across Wisconsin. The Early Childhood Health Consultation Program acknowledges the American Indian tribal nations across Wisconsin and commits to a partnership to improve tailored support in best meeting the needs of each tribal community. Our program offers general guidance on best practices for health and well-being in early childhood settings. Any questions about a specific child should be directed to that child's primary care medical home. For today's webinar, we will kick it off with an introduction, have centralized content, ample time for question and answer, and a few closing remarks. If you are interested in continuing education credit with the Wisconsin Registry, please stay tuned for the end of today's live webinar event. Your information can then be entered in the post-webinar survey, which will be a link included in the Zoom webinar chat at the end of today's webinar. Also, if you're interested in receiving a recording or resources following today's event, all registered individuals can expect an email within a week after today's webinar, which will include links to the webinar recording and a copy of the slides. There are a few Zoom webinar features enabled during our time together. The first is the chat. Feel free to enter any comments directly in the chat. You can use the drop-down arrow to send your comment to the host and panelists or to everyone. We also have the Q&A feature enabled. Any questions are welcome throughout today's presentation. You can enter your question there and check the box to send it anonymously. And now I will hand it over to our program director, Dr. Dipesh Navsaria, to tell us more about today's objectives.
Good afternoon, everyone, on this somewhat chilly January day, very appropriate for us to be talking about winter. As you heard, we will be discussing common winter topics today, including childhood, in early childhood settings, including cold weather, vaccines, and how illnesses are spread. We'll talk about different resources and strategies you can use to try to keep everyone healthier, since probably attaining perfect health in the middle of winter is a challenge and probably impossible. And then talk about how we can be a resource, of course, for everything that you do. Our speaker today is our very own nurse consultant, Kelly O'Connor. If any of you have written, called, or communicated with us with a consultation question, you have most probably encountered Kelly, and we are thrilled to have her presenting today on this subject. Kelly, take it away.
Hey everyone, thanks for that intro. Thanks everyone for being here with us today. My name's Kelly and I've been a pediatric nurse for 9 years, and I'm really excited to be here with you all today. I may have met some of you before, so it's good to see you all again. Today, we're very appropriately, like Dr. Navsaria said, going to be talking about germs in the context of winter and what that might mean for your classrooms, for your own health, for the kids' health. So feel free to throw questions in the chat and we'll get to them at the end. And we'll just kind of dive right in here. So let's start off with, what does it mean to be sick? We've all been sick before, kind of a rite of passage of being human, right? So we all know some of the symptoms that can come with being sick. You'll have a runny nose, a cough, sometimes a fever. So I just wanted to take a moment to talk about what it means to be sick. Being sick is your body's response to a germ. There are lots of different types of germs out there, and it's not our job as normal humans to know all of them. That's what Dr. Navsaria and other pediatricians are for, to know all the different types of germs that are out there. Common ones that we talk about in everyday life are viruses and bacteria. So like I said, being sick is your body's response to being exposed to one of those or being overwhelmed by one of those.
Kelly, I just want to throw in a comment here, which is we often think about about viruses or bacteria making us sick, but the reality is all those things that you just talked about, of course, are because of the body's response to the invader more than anything else. And I think it reframes it for us in a very interesting way, doesn't it? That when you have that runny nose or when you're tired or have diarrhea or vomiting, that's actually in part, that's your body trying to make itself better.
Exactly. Whenever I'm sick personally, I try to even though I'm feeling like, poop, I try to be a little grateful that my body is doing what it's supposed to be doing to keep itself healthy. It's a nice little reframe. So let's take a moment to talk about cold weather in the context of illness. So the truth is that cold weather is not what causes you to be sick. Being outside in the cold isn't an indicator that you are going to become sick. So you don't have to worry about overbundling kids or yourself to be outside. But there's a lot of belief that being outside and becoming cold might cause you to be sick. So let's talk a little bit about why that might be something that people think frequently. And it's because cold weather kind of causes a reflex in your body to protect mucosal linings in your body. So that's why you often see a runny nose when you're out in the cold. It's sort of sort of like a reflex for your body to stay nice and moist. So just because a kid is outside running around and having a runny nose, that doesn't necessarily indicate that they are sick. It's just their body's response to feeling cold. Um, so going into that, like, why do we see more illness in winter then? And the truth is, it's because more of us are inside, touching the same things, breathing and talking closer together with less good ventilation, which are that creates more opportunity for a lot of different types of germs to be spread. So we're being more exposed than we would be in the summer when we're outside. Because when we're outside, we're not as close to each other. There's kind of natural disinfectants around, like the sun, um, and not touching the same things like doorknobs or something like that as frequently. We saw a lot of that in COVID and the idea of social distancing. So same thing applies for other viruses too. So kind of going back to like, how do you tell then if this kid has a runny nose and this kid has a runny nose? How can you tell whose is from being outside and who's because it's a viral or a symptom of having a virus? So it really takes kind of taking the whole picture of the kid to determine what that runny nose could be from. So let's say we have one kid who's been running outside all day. They come inside, they still have a lot of energy. They're eating, they're drinking and acting like they normally would, and their runny nose goes away. That was probably a runny nose from being outside. But let's say we have another kid who comes in, they're feeling really tired. Maybe they have a little bit of a fever. They go outside, they come back in, they still have that runny nose, plus all those other symptoms of feeling really tired. That kid kind of sounds like they have something viral going on, and that might be their runny nose might be from being sick instead of from being outside. Dr. Navsaria, anything to add on this topic?
I'll just make one more comment, probably because I had this conversation at least 7 times last night in urgent care, which is dry air also is a factor in the winter. Our heating is on, and therefore the air gets dried out, and that means the linings of your nose and all also become drier. And it's actually easier. The studies that show this. It's easier for viruses to infect you if the things are a little more dried out. So this is where humidifiers not only make you more comfortable, that you just don't feel quite as dry, and fewer nosebleeds and things like that, but it may actually reduce the risk of infection transmission. There's actually some COVID-related studies showing that higher humidity, not crazy high, please do not make a tropical rainforest in your rooms and have mold growth, okay? That's such a thing as too much. But check and see if the furnace in your building has a humidifier and is it properly cleaned and running and working. And if you don't have a humidifier on your furnace, then thinking about putting a cool mist humidifier in rooms. I often get asked, warm mist versus cool mist, is there a difference? The answer is yes, it's the heat. Moisture is moisture. I actually tell people to use cool mist because if it gets knocked over, there's not a risk that someone's going to get burned by the hot water. So just go with the cool mist. There's no real difference otherwise.
That is a very good reminder that I need to go get my humidifier out of my closet and set that up in my house today. So taking another step further into what is a germ, germs are very tiny particles. We can't see them with our naked eye. We need a microscope to see them, but we know that they live with us everywhere. And not all of them are bad. Some of them are actually really good for us. A lot of them live in our gut and help us digest. So there's a lot to be thankful for in the germ world. They typically get a bad rep because they're associated with sickness a lot, but there's a lot of great germs out there that help us survive and that we couldn't live without. So when we're thinking about germs, I kind of like to think of them in regard to different types of animals. Different germs have different structures and different qualities that different animals have. So just like, we can predict that a cow will say moo and a cow likes to eat grass. And a lot of times a cow likes to live on a farm. We know about the common cold virus called rhinovirus. We know that it typically will cause a scratchy throat and a runny nose or a little fever, and that it's spread through the air, through talking or and through touching and getting into a kid's mouth or something like that. So just kind of a fun way to think about different types of germs having different kinds of personalities and things that we can predict. And it's not, it's not very necessary to know exactly what kind of germ you're dealing with. And we'll dive into a little bit more of that later in the webinar about different patterns that we see with different types of germs. Move on to the next slide now. So here's a list of a lot of different types of germs, mostly viruses and bacteria on the slide, that we think about a lot or that are very relevant to children. Again, each one has its own predictable structures and ways it affects the body. I split them into two lists here, viral and bacteria, because I wanted to take a moment to talk about antibiotics. Viruses are structured very differently than bacteria. And things like antibiotics will not work on a viral infection. So let's take the example of like a sore throat. If a kid has a really bad sore throat and is checked out by a doctor, unless the doctor sees clear signs that that's a bacterial infection, they won't recommend an antibiotic because the antibiotic could actually cause more harm than good in a viral situation. So I just wanted to take a moment to talk about how trusting your healthcare provider that you see in context around, is this viral, does not need antibiotics, or is this bacterial, does need antibiotics, is really important for the health of our community and the health of the individual body. So it's really important too that, families and parents aren't saving antibiotics that were prescribed for one infection and using them later on. Because like I said, with viruses, antibiotics will not treat those infections. And that's kind of going back to what we were talking about. The structure of the virus is not affected by an antibiotic. Let's see. And then anything to add on that note, Dr. Navsaria?
No, and I'll just say this is maybe more than most people want to know, but viruses actually reproduce inside your body's cells. So that's the other reason antibiotics can't get at them. And even so, different antibiotics are used for different types of bacteria. So that's why saying, well, I have a few pills left over, let me just start this, is usually not a good idea, because it may actually not be the right one for that reason.
Exactly. Also on this slide, I wanted to point out, I have highlighted here, especially at the bottom, those purple kind of highlighted illnesses. And we don't really see much of those anymore, thankfully, because of vaccines. I'm very fortunate. I've been a nurse for almost 10 years, and I've never seen a case of the measles, which I'm thankful for every day, because the vaccines do a really, really good job at keeping the prevalence of these in our society really low. We'll talk a little bit more vaccines here in a little bit, but I just wanted to point out that these are ones that we think about a lot in pediatrics and for kids, and how thankful I am that I've never had to see a case of these ones that historically have been dangerous for kids. Also, the RSV right there in the middle, highlighted in yellow. I know that that is something that's going around a lot right now. We're seeing a lot. And actually within the past few years, different types of defenses or vaccines have been developed and implemented into the world. One of them is really cool, actually. Pregnant moms can get an RSV vaccine. And then the antibodies, or the proteins that protect a baby from RSV, get passed along to the baby when it's born. So there's just a lot of exciting stuff happening in that realm right now. And the reason we're so adamant about kids getting vaccinated is because they keep the prevalence in our world really low. And if we can avoid these illnesses, that's the best way to do it.
Kelly, if I could just make a comment here about two things. One, yes, vaccines save lives. That is very clear. It has actually changed the face of childhood in just the last 100 years. The other thing is, to what you mentioned about the RSV vaccine. It's strangely, a lot of people don't know that there's a big transfer of antibodies from moms to babies late in pregnancy, and that lasts for a few months. So that's why you tend not to see, for those of you who care for the babies in the 6-week to 6, 7, 8, 9 months of age, you don't tend to see a lot of viral colds in those really young infants, and that's because they're benefiting off of mom's antibody protection. Sadly, it only lasts for a few months, and then you get your toddlers running around with every virus out there. We all did that at the same age, but it's something that a lot of folks don't seem to know about.
Okay, we can pop on to the next slide. So more about vaccines, kind of reiterating what Dr. Navsaria said, is vaccines save lives, and I am thankful for them every day, especially in the context of pediatrics. They're the safest and most effective way to protect kids from those illnesses that historically have been very scary, like we were saying. And like I said, too, the reason we don't see a lot of some of those illnesses that were on the last slide is because the vaccines do a really good job at protecting us all from them. Just to touch a little bit on the way vaccines work, the vaccine that kids receive tell their bodies to produce something called an antibody, which is the fancy word for a protein. And that antibody is kind of wired within you to protect you from that virus when it comes your way. So someone with a measles vaccine, for example, if they come in contact with measles, their body already has that defense system ready and armed to protect them from actually getting the measles. And we can move on to the next one.
Kelly, I'll just jump in real quick to say,
Yeah.
some of you may be wondering, well, if we've managed to keep measles at bay and be virtually just non-existent in our society, why can't we do that for influenza and for COVID and things like that? And the answer is, thank goodness, measles, which is an extraordinarily contagious illness, makes COVID look like nothing, quite frankly. Measles doesn't change much. It doesn't change at all. So the good old vaccine we've had since, what, 1950 something, still works against all measles. It just doesn't mutate or change. COVID, influenza, you've heard all this talk about variants and strains and all that sort of stuff. Yeah, unfortunately, it shifts and mutates. So the vaccines aren't continually effective because of those changes. So that's something to just recall and remember. And I will highlight, as much as we're talking about how measles is not a significant concern in general in the United States, we still do see cases of measles pop up. Some of you may have heard about the large outbreak of about 60 kids that were developed measles in Ohio just a few months ago in childcare settings, just like the ones you folks are in. And that was largely because of most of them, actually, I think all of them not being immunized. So it's still out there, and that's why immunization is still necessary.
Mm-hmm. As long as we keep getting vaccinated, hopefully it will continue to stay at bay. Another thing about vaccines too that a personal story is there was one year I'd gotten my flu shot in nursing school, and I got the flu later, the influenza, so fever, malaise, or tiredness, that kind of flu. But it was very brief, and I got over it very quickly. And the doctor told me while I was in nursing school, that's because I got the vaccine. So vaccines, like the seasonal ones like flu and COVID, while they're not perfect, they still protect you from getting very, very, very ill from that, whatever that strain is, whether it's influenza or COVID. So that's why it's still important to continue to get them and have faith that they will protect you from, even if you do come down with the illness. So next, we're going to talk a little bit about contagiousness and what it means to be contagious. So when we're saying contagious, we're talking about how germs are spread. So to go back to our animal analogy, some animals fly, some run, some dig under the ground. Same kind of goes with germs. Some are spread through the air, through talking with each other. Some live on the surfaces that we touch. Some live in poop. Some live in puke. There's all different places that germs like to live and spread from human to human. So when we're talking about contagious there, we're talking about a contact spread, that's contact with a surface or another person that then makes its way into your body through having been contacted by your hands usually. Droplet, meaning someone's coughed on you. Airborne, meaning that the particles are kind of floating in the air and you breathe them in. Or bloodborne, meaning that fresh blood is exposed to a mucus or another open area of blood. So lots of different ways that different things like to spread. And we'll talk about a little bit next about how we can kind of stop those spreads based off of predictability on where different germs like to live and how we can maybe slow some of that down. Let's see. And then under non-contagious, you'll see things like ear infection, sinus infection, classical pneumonia. Those are things that kind of develop within you. I think ear infection is a really good example of this. Kids' ears, you'll notice adults don't really get ear infections that much, right? But kids do. And part of that is because the structures of their ears as they're growing are shaped differently than us as adults. It doesn't really allow for optimal drainage for fluid to kind of pass through their ears. So after they've been sick, a lot of boogers kind of getting everywhere, they'll start to feel better. They won't have necessarily the viral symptoms anymore, but they won't have necessarily cleared all that fluid from their ears. That will kind of pool up and present as an infection and really hurting and bothering their little ears. I'm sure everyone's seeing a lot of that right now as I am right now in the hospital as well. So that's just an example of something that can't be passed from kid to kid. It just kind of developed within their own ears. So that's a good example of a kid who has a fever but isn't necessarily contagious.
Yeah, let me also point this out because this was a question that just got asked in the chat was about can ear infections be contagious and making the observation that sometimes when one child gets an ear infection, it never fails that another one seems to get one. So let me explain what's probably happening in that phenomenon. I view actually all three of those things that you listed there, ear infections, sinus infections, pneumonias, um, I view them as complications of colds. So there's usually a viral something that started, and you got congestion and all that business, and it's blocking up those little tiny passageways you just talked about and allowing an ear infection to develop. The ear infection itself is some bacteria that naturally live, and same with pneumonias and sinus infections. They're often bacteria that naturally live in our nose and throat. They're there, they're already there, but usually they're not a problem. In this case, however, that stuff's getting gunked up. The body can't clear it out as much, and now you get those complications. So you could have one child gets a virus and another child gets a virus. The first child never gets an ear infection or a sinus infection or pneumonia, but the second child does. Bad luck. Their passageways are just narrower. Whatever, there's some other reason there. But this is why if one child has an ear infection and another one doesn't, they could rub their ear on the other kid for all I care. It doesn't matter. The infection itself is not contagious, the ear infection. The virus, on the other hand, that led to it could be, and that's why you're going to see if you have a room of 10 kids, another one might develop an ear infection if they also are prone to it or have that same bad luck. But it's not the ear infection itself that's contagious.
Thankfully, right? It's
I'm
hard.
also going to I'm going to answer one question that popped up in the Q&A just because it's on sinus infections immediately. The question is, what if a child has green thick nose drainage and seems miserable but no fever and has lasted for months? What advice would you give the parents? That's actually a really easy one to answer. They really need to be seen. There's no reason that a kid should have thick drainage from their nose continuously every single day, certainly not for months. The usual line I would tell people is if it's getting close to or past 3 weeks of a, a nasal drainage every single day, if there was this no day without a break, that needs to be looked at, and then let us figure out what might be going on. Granted, sometimes I know this happened last winter, and I think it's already happening this winter, that people are coming in and saying, my kid has had their nose running for like weeks on end. And when you really drill down, okay, maybe there was a few days it was okay. They're just getting virus after virus after virus, and that's what's happening. We had a really rough viral season last year. We're having another rough one this year. But if it's continuous every single day like that, yeah, once it gets past, 3 weeks or beyond, that definitely needs to be evaluated.
Yeah. Definitely when you're seeing those back-to-back or prolonged illnesses, it's hard to have the attitude of I'm thankful my body is reacting in the way it's supposed to. So let's talk a little bit more about how we can, now that we know what is contagious and what's not contagious or what contagious means, we can talk about how we can potentially break the cycle of spreading illness or slowing it down. So again, like I said, different germs spread in different ways. And this rule of thumb isn't perfect, but as a general rule of thumb, we can assume that stomach bugs or things that cause diarrhea or vomiting and things like hand, foot, mouth, those germs aren't really sensitive to hand sanitizers, to alcohol-based, like a Purell or something like that. So if you are seeing a lot of kids with a stomach bug, with a lot of poop, or something like hand, foot, mouth, it's important that providers are washing their hands with warm soapy water for 20 seconds. And the reason for that is because those germs aren't able to be broken down via alcohol-based hand sanitizers. And the best we can do is to wash them away. So the warm soapy water, kind of like the soap, like actually grabs on to the germs, and the warm water washes it away. So that's the best way we can prevent that contact spread. So, I touch one thing and then touch another thing, and then the kid touches it, and then it's in and around their body. That's what we're trying to prevent. And that's how we break the cycle of that kind of spread. When we're talking about illnesses that typically present with coughing, sneezing, mucus, again, this isn't a perfect rule of thumb, but generally those germs are sensitive to hand sanitizers. So if you're having, something like a sniffly nose that's going around the room, using extra hand sanitizer as much as you can should be effective. Along with you as an adult or anyone that's, old enough to wear a mask could also wear a mask if you want to protect yourself. And there's a lot of, mucus flying germs all over the place. We get the question a lot too about, well, what do we do with the 2 and under population who can't wear masks? How do we maybe slow the spread for them? And again, like we talked about, germs, getting sick is kind of a rite of passage of being a kid and a human. It's going to happen. But if you are trying to slow it down in the classroom, something you can do is try to improve the ventilation, which is really difficult in winter when it's this cold. You can try to keep kids a little further away from each other. 6 feet is impossible in the classroom, but the further they are away from each other, the less likely they are to cough into the area that they're breathing. And trying to teach kids to cover their cough too, which is also very challenging and near impossible. So just doing the best you can, washing your hands as much as you can, and just accepting too that it's winter, and as humans, we're probably going to come down with some viruses. Let's see. So this only applies for things that are contagious. Like we talked about, things like ear infections or sinus infections. This doesn't really apply because those aren't contagious. Those don't go from kid to kid. And there's not really a way to know because we don't have the testing and we don't have the testing to test every single kid and what they're going through, because really it wouldn't change what we're doing. So it's just kind of taking what you have going around in your classroom and responding to that. So we got lots of poop going around. We're going to wash our hands. We got lots of snifflies. We'll use extra hand sanitizer and wear a mask. But most importantly, the thing that families can do is vaccinate their children. And that is the #1 way we can prevent spread. A really good resource here, if you're wondering like, ooh, how do I clean this thing if we have this kind of illness going around? The CDC has amazing resources for how to clean and what to clean with in a safe way for kids. So I definitely recommend looking stuff up there if you're looking to clean down some surfaces too.
And we can post that link in a moment as well.
Yeah, for sure.
I'll also refer people to last month's webinar on which covered things like ventilation, right, on air quality, because we've discovered how much, COVID of necessity gave us the opportunity to look into a lot of things that people usually just didn't think were worth investigating, like what is the viral spread in rooms, and how much does ventilation matter? We discovered to our surprise that everyone assumed that airplanes would be like crazy, right? Like you get on an airplane, you're stuck with all these people for hours. There's going to be crazy viral spread. Guess what? It wasn't, because there's something like 22 air exchanges an hour going on once the engines are spun up and the ventilation's going. So recognizing that good ventilation, which is not necessarily easy, if you're in an older building, retrofitting your ventilation system could be crazy expensive, but recognizing that if you have a choice, or at least asking the question, how many times is air being exchanged in our facility, can help reduce some of that airborne spread as well. And sorry, and I'll say one more thing about masks. One of the reasons we're really emphasizing masks, there's a lot of talk out there in the last couple of years about, oh, masks don't work, masks, didn't change anything, et cetera, et cetera. That is absolutely false. If you actually look at the really well done large studies, they do show that masks do help, that they do make a difference. They've saved many lives and reduced transmission greatly, not just of COVID, but also just other viral illnesses. And if the large studies don't convince you, I will point to Kelly and I right here in our day jobs, which is working with sick people. Sick people come to see us because of what we do. And we are masking 100%. And I've had a mild cold here and there, but I certainly am not getting ill repeatedly over and over and over again. And yes, of course, I'm fully immunized. And yes, of course, I'm, being cautious and all those sorts of things. But honestly, when I'm examining a child, I'm right up in their face and some of them are coughing right on me. Yes, but I have a mask on. So I think that's fairly convincing. There is a question in the chat that we'll maybe just take right now because it's on masking. How often should you change the mask?
That's a great question. So a general rule of thumb to make a mask last as long as possible, cleanly as possible, don't touch your mask with dirty hands. I see that a lot, even with other nurses, and I'm like, touch it. So make sure that you're washing your hands really well before you remove the mask. In an everyday setting, I would say I would probably change a plain mask, so a non-N95 mask once a day. It should last you, I would think, a full day in the classroom, unless it becomes wet, or if there's any compromise in the fit of it, like, oh, it tore a little bit here, or it got really stressed out or stretched out and it's not really fitting my face anymore. Or if you realize you've touched it with dirty hands. Those are all reasons I would change my mask. Dr. Navsaria, any words of wisdom there?
I think if it's getting soiled or wet or something like that, by all means, definitely do. Other than that, it's I wouldn't wear one, weeks on end. I think when we had shortages at the beginning of the pandemic, we didn't really have a lot of choices, but masks are pretty plentiful now. So changing out once a day is probably perfectly fine.
And some tricks about masking too. It's everybody's face is a little bit different. So tricks you can do to make it fit tighter or better to your face, because you do want like as tight as a comfortable tight as possible. I twist the stretchy part right here and put it around my ears, and that allows it to fit to my face a little bit tighter. So just kind of experiment there on how you can make your mask fit better for you.
There's one other question asking how long to wear a mask. I think that's probably asking like how long through an illness.
Oh,
Um,
yeah.
I think the answer would be really, well, first of all, avoiding coming to work ill is a good thing. I actually have to say, I even heard in a meeting very recently, like even in medicine, like we're changing this culture of, well, you show up to work no matter what, even if you're ill, that now it's like, hey, if you're ill, you really should call in because you don't want to spread this to others. And I'm glad to see that attitude changing in healthcare. But I think often masking is more of the question of, you know, you start having symptoms while you're at work and you're just like, I don't know, do I have a sore throat or not? Or is it just something, it's that sort of in between sort of thing. Put on a mask at that point, right? When you're not sure. And then when it's clear that you're ill, that may be where you got to say, yeah, I can't come in. But really, otherwise, it's while you're having symptoms.
Yeah, that is a very kind thing to do for your coworkers as soon as you start to feel that, because that's actually the point where a lot of viruses are most contagious, is right before you feel that you are actually sick. So it's a very kind thing to do, to put on a mask if you're unsure, if you're starting to feel ill. which is why they're so good at spreading so fast, because it's usually before you even know you're ill, they're starting to spread. Tricky germs. Okay, let's move on to the next slide, our immune responses. So our defenses, our bodies being strong and reacting to our environments around us. Fevers are a big way that kids' bodies respond to fighting off an illness. So fevers themselves are not dangerous. They're actually the body doing what it needs to do in order to defend itself from an illness. So like we were talking a little bit about earlier, your immune response is something called antibodies, or different proteins in your body responding to a germ. And they can come into, those antibodies can be in your system in many different ways. Vaccines are an amazing one because you never have to experience the illness to have that protein or that defense mechanism. Breast milk is another powerful one. Dr. Navsaria talked a little bit about those first 3 months of life, that transfer of antibodies that happen for the really young babies. And there's also like if you have the illness, like let's say I got the common cold earlier, rhinovirus, my body will make antibodies or make those proteins to live in my system and defend me from future exposures of that same virus for this season until that virus kind of mutates for the next season, because germs are very smart and good at mutating to get through the next season. So this is, anything to add here, Dr. Navsari, about fevers?
Less on fevers, but more on just immune response in general. This is why, so the immune system is complicated. It has many different pieces and parts to it. Some of it is a more immediate response, and that's more general. Some is more specific to specific illnesses, that whole antibody thing you were talking about. So this is why when people say things, we see marketing like, this product will boost your immune system. All of us in healthcare honestly look at that and go, what does that mean? It doesn't, there's no such thing, there's no big knob saying immune system and you turn it up or turn it down. In fact, an overactive immune system that you've boosted too much, if you could do such a thing, is how you get autoimmune illnesses, like rheumatic disease and rheumatoid arthritis and things like that. So yeah, when you hear people talk about boosting immunity, like in this very general sort of way, it doesn't actually make a whole lot of sense because there's so many moving parts to the immune system that work in very different ways. And I agree with everything you're saying about fevers. I see a lot of families coming in whose concern is about fever and about fever being dangerous. As I always say, treat the child, not the thermometer.
Exactly. And I think it's probably sometimes confusing for families because we're always asking about fever, like, oh, does your child have a fever? But the reason for that is more of it's just a one piece of the puzzle. And if a kid is otherwise acting fine and normal and eating and drinking, it's not super concerning. But the reason healthcare professionals will maybe ask is because it's a piece of the puzzle fitting together of what's going on with your kiddo.
Speaking of fevers, there is a question about the proper way to take temperatures in a childcare setting since they're not able to do rectal temps.
Oh, that's a great question. So never add or subtract a degree when you're taking a temperature. No matter where you get it, the number you get is what you get. I know different facilities probably have different type of thermometers to share between kids. In my work, I like to use under the arm in kids, just making sure that they're not over bundled or under bundled, that they're in a normal temperature room. And then just making sure that there's a good seal right underneath their armpit. That's a friendly way to do it for all young ages. The ear ones where you stick it in their ear, those are a little unreliable because it's so hard to get a kid to stay still like that. And if there's some air in between, too much air, it might read too cold, or if it's too too close and might read too hot. So that's why my preference is to use under the arm. You can share thermometer, clean off the thermometer once you're done using it with one kid. Usually an alcohol swab or something is a safe way to do that. But then that's a relatively safe way to share a thermometer too, is if you're just using it under the arm.
Some folks may also use some of those forehead kind of scanner ones, and those are also seem to be okay. Never, I think they're largely gone now, but never use those forehead like strip that you hold up and that like changes color. Those were remarkably inaccurate. But yeah, I agree with you. The ear ones are just sometimes they're just hard to get at the right angle, more than anything. So a relatively straightforward, just under the armpit, is all you're looking for. And make sure that the probe isn't sticking out the back where take a peek and make sure it's actually in the armpit there. Again, and there's another question that I'll also address here now, which is at what temperature should you be concerned? Which is a great question, and I get asked that a lot by families. I so wish that the number told me when I should be concerned. It would make my job so easy. Uh, there isn't. I've seen toddlers with fairly straightforward viral illnesses that they'll get better without any other intervention in a few days. So just bring the temp down to make them comfortable, but there's no danger. High as 105, easy. See it all the time, right? And they're going to be just fine. I've also seen kids at death's door with perfectly normal body temperatures, right? So it's one, as you said so beautifully, Kelly, that is one piece of information. A child who has a temperature of 103, and I walk into the exam room and they're moving around, exploring the place, opening all the drawers. Okay, that child is moving around and doing what I expect a toddler to do, versus a child who may have a normal body temperature, who's same age and is lying there kind of limp in their parents' arms. That kid worries me much more, even though their temperature is normal. So there's not a temperature that one piece of information would make me concerned, with one exception. For those of you who do take care of kids under 3 months of age, any fever is something that should be evaluated by a healthcare professional, at least by a phone call, and let them deal with it from there. Higher risk of significant severe infections. Not a guarantee, but just higher risk in those young infants. So any temperature at all, any fever, meaning 100.4 or above, should be at least warrant a phone call to that child's primary care provider to evaluate from there.
Yeah. And I think another thing about fevers too is that a lot of times in our community, people assume, oh, this kid has a fever, they have something contagious. Not necessarily. We see fevers with ear infections and stuff like that, which we talked about earlier, aren't necessarily contagious or are not contagious. Those are really good questions. Keep them coming. So we just wanted to throw in a slide here too, because this is another common question we get a lot in healthcare is, what's the difference between having immunity to an illness through vaccination or getting the immunity through having the infection itself? In my opinion, as a nurse, it's better to have the immunity through vaccination because you won't get as sick and it is decreasing the chances of hospitalization or other things like that, which are still rare, but the risk is there. So in my opinion, it's much better to have and safe to have immunity through vaccination to prevent some of those complications that could happen for a small amount of the population. It's also important, I think, to think about in rare instances, and this will be determined by a pediatrician or a doctor, some kids and people aren't eligible for certain vaccines for really rare reasons. So it's important as a community, we take that into account too. And the more of us who are protected and vaccinated, the less likely those individuals are to get illnesses passed along to them as well. Dr. Navsaria, anything to add about that?
Yeah, no, I completely agree. I'll give you just an example of an illness that has gone from being extremely common to barely ever see it anymore in my career, which is chickenpox. We used to see chickenpox all the time when I first started in practice. Could identify it from a mile away, et cetera, et cetera. And then we began immunizing in, I think it was 1999, in the United States. And now the few rare times I see it or see what might be a case of it, because the vaccine actually makes it look, much, much, much less severe. I'm grabbing like every trainee I can find, residents and medical students and whatnot, and saying, "Hey, look, you'll probably never see this. This is chickenpox," and so on. But as a child, I had chickenpox, like most kids did. I got it at a little bit of an older age. There's a scar somewhere in my forehead from one of the pox lesions, that's been there my whole life. Um, and just to give you an idea, in the US annually, about 20 children a year would die from complications of chickenpox, usually skin infections and rarely brain infections like encephalitis. That's not a large number, but it really mattered to those 20 families, of course, right? And it was utterly preventable once vaccination came out. So again, vaccines let you develop the immunity without the risk of what the disease can cause. They're stimulating the immune system otherwise in a very similar way, which is lovely in terms of just great innovations of our modern time. There's a couple of vaccine-related questions that I wanted to address. One is was shared a while ago in the talk, and I held it till now. Can you explain why a vaccine still works to protect us, even though it's a different variant of flu or COVID than the vaccine strain?
Yeah, that's a great question. So the way seasonal vaccines are developed are really smart doctors are looking at last year's structure of that germ and predicting what the structure is going to be for the next season. So the things like influenza, the flu, or COVID, we really smart people with lots of schooling can predict, way above my pay grade, can predict how those are going to change and develop a vaccine with their best guess. So while that guess isn't perfect, it's really darn close. So that's why some people might still get infected, but the vaccine is still protecting enough because the structure of the germ was similar enough to last year's, and they developed it in a way that they can predict is almost perfect to the next year's. That's why you still are at risk for getting it, even if you still have the vaccine. And why it also still protects you, mostly, usually. Um,
Yeah. The other way I'd think about this is, and Kelly, I'm going to have you do something slightly silly here, okay? Could I have you hold up your hands just over your face? Yes. So I've seen Kelly enough times that even though I can't see her face, I can see by her hair, by the shape of the outline of her face, by her shoulders, etc. I still know it's her, right? Similar sort of thing. Even though some key features in a virus might have changed, enough is there that there's at least some partial immunity there. It's all about the ends of the antibodies and what they're looking for, that you can identify some of it, if not all of it. So we have a handful of questions coming in. These are great. Do children get fevers after they get their vaccinations?
Yes, they do. And that is a good thing. That means that their body is responding in a way that is creating those antibodies, those proteins, all those things that we were talking about earlier, to be prepared for when they come into contact with that germ in the future. So it's a good thing when they get when they get a fever after having a vaccination. It is okay to give Tylenol to kids after they have their vaccines to try to prevent that too.
Yeah, not all kids will get fevers, but they do. I used to tell my kids when they'd gripe about how their arm was sore and they were, had a mild fever or whatever, I'd say, "Congratulations, you're having an immune response. That's how you know it's working." And they'd just like give me this look like they wanted to kill me, but whatever.
I can see the eye rolls from here.
The question about providers will see fevers in children that are teething. Is that fever due to teething or some other illness? I'm going to take this one because I've thought about this a lot. There is no actual real evidence that teething causes fevers or anything else, quite honestly, despite the fact that you will hear healthcare providers say this. There's no reason that a tooth coming through gums should cause fevers or anything else. Teeth coming through gums in older kids, like getting their adult teeth, almost never causes pain. So why would it in a young child? The reason I think that people claim fevers and pain and diarrhea and all sorts of things are due to teething is because the first tooth shows up around 7 months of age, give or take, varies in children. What else happens around 7 months of age? Hey, remember what I said earlier about maternal immunity, that those antibodies that pass through the placenta-laden pregnancy, they wear off around the same time. So now kids are getting all these viruses. It's probably those viruses that are causing the fevers, the diarrheas, fussiness, et cetera, and nothing at all to do with teething. You want to, and then you want to give kids teething rings? Be my guest. It's absolutely fine. They mouth all sorts of things. We know that. But yeah, I would not, if a kid has a fever, I would not say, oh, it's just teething. That would be incorrect and not in line with any sort of scientific thinking. We have one other question that I want to make sure we address before we wrap up here. Does having a health condition like diabetes really make you more vulnerable to COVID?
Ooh, that's a great question. Dr. Navsaria, I'll have you field that one.
Yeah, I would say that it can. Things like diabetes or other things that affect really every part of your body, right, in terms of just how it operates and runs, and diabetes is certainly a great example, can pose challenges for almost any severe illness. So let's say you have diabetes and you're going in for surgery. It'll be important for them to know, of course, that you have diabetes because it might affect some things that happen in during the surgery, how they might respond to things, how they might need to be prepared for certain things, et cetera, et cetera, et cetera. So similarly, if you get something like COVID or any cold virus or something, yeah, you may have a more significant illness if you have this underlying condition like diabetes. It's not a guarantee that you're going to die. It's not a guarantee that you're going to end up in the hospital or anything like that. But it means if you took 100 people with diabetes, more of them are likely to say end up in the hospital with COVID than those who don't have diabetes. It's just a higher risk, and it's just something to pay more attention to in different ways.
Wow, what a great collection of questions. Thank you everyone for your engagement today. With our last few minutes together, we just love to highlight a few components of our program. Early childhood health consultation is here to help support your health and safety questions. In addition to webinar training such as this one, we also have an on-demand resource library on our website, a podcast titled Teachers, Toddlers, and Tissues with monthly episodes, as well as free health consultation. So we're excited to share that our health consultation service areas are rapidly expanding with the aim of statewide support. Feel free to check out more details, including specific locations on our website. And we also invite you to listen into our podcast. 10 episodes are now available. Feel free to listen or subscribe using your favorite platform. We also invite you to save the date for future monthly webinars. More details, including upcoming registration links, are coming soon on our events page of the website. We invite you also to contact us. If you have any outstanding questions that maybe you have lingering from today's webinar, please don't hesitate to reach out to us. You can reach us phone call or text, email. You can also reach us on our contact forms on our website. And we also have social media. We'd like to say a special thanks to the many early childhood providers who offer us ongoing guidance to best meet the needs of programs and the children they serve, including our very own advisory board. We'd like to thank our colleagues from other childcare health consultation programs across the United States, our current project partners, and our past project team members. A few reminders as we wrap up our time together is Feel free to enter any feedback on this webinar as we seek to improve future webinars through the post-webinar survey link. That link can be found in the Zoom webinar chat now. This is also a great place for you to enter your information if you are interested in continuing education credit with the Wisconsin Registry. Also, following today's event, you can expect a follow-up email with a link to today's recording, as well as a link to the survey link just in case you need it. And any information entered through that post-webinar survey will be entered directly with the registry for attendance credit. Okay, I'd love to direct your attention again to the Zoom webinar chat for the post-webinar survey link. And with that, I will hand it back over to our program director, Dr. Navsaria, for closing remarks.
Thank you so much, Maria, and thank you so much, Kelly, for that informative presentation. As you can tell from the comments in the chat and so on, people were very appreciative for the information that you shared today. Remember, these are all recorded. They will be on our website. So if someone was not here who you think should have been here, they will they too can listen to this and take advantage of this great information. Thank you for everything all you folks do, and thank you for the kind comments and accolades in the chat. It makes us feel happy to do the work that we do in supporting you and in helping make the lives of children in Wisconsin better every single day. Thank you so much.